Hi, everyone. Good afternoon. My name is Nia Ragland. I am the Well Ahead Wise Woman Grant Manager, and today we have a very informative webinar for you today. So just to begin with a few little minor things, I would like to begin with stating that if you have any questions, to just drop them. I'm sorry. To just drop them in the chat. And we will address them in the end of the Q&A segment. And so today, to begin today's webinar, we'll have a brief introduction from our Bureau Director, Ms. Avis Richard.
Good afternoon, everyone. If you can hear me, just give me a thumbs up. I'm not sure if you guys can hear me or not, the volume here. Okay, awesome. Thank y'all so much for joining us today. And as Nia said, we have a very informative line up for you today. We have our very own Alicia Jones, who is our Health Equity Improvement Manager in Well Ahead. She's also leading our efforts for an emerging cancer program. And today she's going to share some information with us with regard to breast cancer. What I'd like to say, a disclaimer today, unfortunately, we were not able to get our medical professional on today. We will, for our next series, assure that we have that medical professional there, but they had a conflict and could not join us today. But we do have some very informative information for you, and you will hear from a survivor today, hear her journey in terms of how she discovered she had breast cancer, what she did about it, and how she got on the path to being cancer-free. So I'll turn it back over to Ms. Nia Ragland.
Thank you, Ms. Avis. So at this time, I will introduce Well Ahead's very own Alicia Jones. Alicia is the Health Equity Improvement Manager under the Division of Health Equity and Policy in the Bureau of Chronic Disease Prevention and Healthcare Access at LDH. Alicia leads and facilitates the Wise Woman program as well as the Asthma Control Program for Well Ahead, Louisiana. She serves as a subject matter expert for her Bureau in Program Management of Chronic Disease-related Conditions, Cancer Prevention, and Health Equity Promotions. She holds a master's degree in healthcare administration from Our Lady of the Lake College with 17 years of healthcare experience and 13 years of experience in quality assurance, compliance, and process improvement initiatives. While Alicia is pursuing doctoral studies with 152 hours completed towards a professional doctorate degree, she has been further intrigued in higher learning by successfully completing LDH's Visionary Leadership Academy as a leader of excellence in public health. Alicia's professional experience demonstrates that she has a strong desire for improving communities within Louisiana by ensuring diversity and inclusion within managing programs. She enjoys helping others with a focused goal to bridge the gap in public health by creating and sustaining equitable policies. Welcome, Alicia Jones.
Hello, everyone, and thank you so much for that great introduction, Nia. I am pleased to be presenting to you all today as it is Breast Cancer Awareness Month, and we support women's and men's health in all facets. To give you guys some background before jumping right in, let's begin with what is cancer? In a healthy body, natural systems control the creation, growth, and death of cells. Cancer occurs when these systems do not work well. When cells do not die at the normal rate, there's more cell growth than cell death. This excess growth can form a tumor. So, what exactly is breast cancer, you ask? Breast cancer occurs when cells in the breast divide and grow without their normal control. Tumors in the breast tend to grow slowly. By the time a lump is large enough to fill, it may have been growing for as long as 10 years, unfortunately. Some tumors are aggressive and grow much faster. About 80% of breast cancers begin in the milk ducts. About 10% begin in the lobules, and a few begin in other breast tissues. Although rare, please remember that breast cancer can occur in men. Next slide, please. So according to the American Cancer Society, Louisiana has one of the highest cancer mortality rates in the nation. We do not have a higher incidence of most cancers. Instead, we have higher death rates. This is due to lack of access to care, delayed diagnosis and treatment, limited educational awareness, and low utilization of preventative services. Next slide, please. So today, you can see the learning objectives for this presentation on your screen. During this session, you will learn the burden of breast cancer in Louisiana, learn risk factors, signs, and symptoms, learn current guidance and preventive screening measures, and learn the services and support available for men and women in Louisiana. Next slide, please. So breast cancer affects women and men of all backgrounds. However, some groups are more susceptible with a higher likelihood of serious outcomes than others. As we can see, the unfortunate burden in Louisiana, currently 1 in 8 women will develop breast cancer in their lifetime. Since 2000, year 2000 that is, Louisiana alone has had approximately 40,656 breast cancer survivors. Black women have a particularly outsized presence in breast cancer statistics. According to the National Institutes of Health, Black women develop breast cancer at a younger age than white women, are more likely than white women to die from the disease, and are twice as likely to develop aggressive triple-negative breast cancer. The reasons for this are myriad. Social, economic, geographic, and lifestyle factors may partially account for disparities. In the words of the Breast Cancer Research Foundation, meaning that raising awareness and taking preventative measures are an increased importance. The social drivers mentioned are underlying drivers of health, and they impact every part of our physical, mental, and social well-being. Next slide, please. So here we have the breast cancer laws and our stance as Louisiana. Breast and Cervical Cancer Mortality Prevention Act of 1990. It was passed in response to the increasing number of low-income and uninsured women being diagnosed with breast cancer. This act requires states such as ours to prioritize low-income women for services, charge for services based on income, and not impose charges on women below the poverty line. In addition to switch to improved screening procedures when they become available, and ensure the quality of screening procedures for all. The Breast and Cervical Cancer Treatment and Prevention Act of 2000, which is Public Law 106354, it gives states the option to provide Medicaid coverage for breast and cervical cancer treatment to certain low-income women, which includes women who have been screened for breast or cervical cancer through the National Breast and Cervical Cancer Early Detection Program, women who have been found to have breast or cervical cancer, including precancerous conditions, and women who are not otherwise eligible for Medicaid. Next slide, please. So, what are effects of risk for breast cancer? What are your effects? So these are things that increase or decrease the chance of getting breast cancer. Anything linked to a person's chance of getting a disease are risk factors. A risk factor can be related to genetics, such as family history, lifestyle, such as exercise, reproduction, such as age at the first menstrual period, the environment, such as radiation exposure. So the exact causes of breast cancer are not fully known. No one knows why one person gets breast cancer and another doesn't. Breast cancer is complex. It's likely caused by a combination of risk factors. Learning about these factors can help you understand the risk of breast cancer. So, with that being said, some risk factors are out of our control. For example, the two most common risk factors for breast cancer are being born female and getting older. These are things you cannot change. However, there are some risk factors you may be able to control, like leading a healthy lifestyle. Other risk factors are still unknown. Since you can only control some risk factors, you cannot avoid some amount of risk. So, most risk factors you have some control over only have a small effect on risk. This means no one behavior will prevent breast cancer, but it also means there's no one risk factor that will cause it. Some risk factors for breast cancer are not preventable, such as getting older, personal or family history of breast cancer, or some non cancerous breast diseases, while some risk factors can be associated with lifestyle choices. Not being physically active, being overweight, or obese after menopause, or drinking alcohol can increase your risk. Next slide, please. So, most early stage breast cancers in the US are found with a screening mammogram before any warning signs or symptoms appear. However, breast cancer can also be found when people have warning signs. So it's important to be aware of these warning signs and see a healthcare provider if you notice any changes in your breast or underarm area. Possible symptoms of breast cancer may include swelling of all or part of the breast, nipple pain, or the nipple turning inward, or even a lump in the underarm area, skin irritation or dimpling, redness, scaliness, or thickening of the nipple or breast skin, or nipple discharge other than breast milk or other possible signs. The most common warning sign of breast cancer in men is a painless lump or thickening in the breast or chest area. How, excuse me. However, any change in the breast or nipple can be a warning sign of male breast cancer, and you should consult your physician. Next slide, please. Screening tests can help find cancer at an early age before any symptoms appear. The earlier abnormal tissue or cancer is discovered, the more options there are for successful treatment. So, what is a screening mammogram? A screening mammogram is a test that uses x-rays to create images of the breast. It's the most effective screening test used today to find breast cancer in most women. Screening mammograms can find breast cancer early, sometimes up to 10 years before it could be detected by you or your doctor. U.S. Preventative Service Task Force recommends women 40 to 74 of average risk have a screening mammogram every 2 years. American Cancer Society recommends women 45 and older begin regular mammograms, and women aged 55 can begin every 2 years. Next slide, please. Okay, and we will now go to the American Cancer Society resource regarding recent updates and screening guidance.
For breast cancer screening for women at average risk of developing the disease. The society recommends that all women begin having yearly
Can you guys see the
mammograms
video?
by age 45.
Yes.
and that at age 55, women can begin getting mammograms every 2 years, but may continue with annual screening if that is their preference. The Society also endorses women ages 40 to 44 having the option to begin annual screening before age 45. Women should continue regular screening as long as their health is good and they can expect to live 10 years or longer. According to the Society's Chief Cancer Control Officer, Dr. Richard Wender, new research has helped doctors understand the best ways to use mammograms for screening.
Since we last wrote the breast cancer screening guideline, which was all the way back in 2003, there have been the publication of quite a number of new studies that inform us about the benefits and drawbacks of screening with mammography. So the American Cancer Society commissioned a detailed evidence review by an external expert group to review all of this new data, which was then presented to our American Cancer Society guideline committee. That committee then considered all of this evidence over a period of months, did the very difficult job of balancing the benefits and harms, and that's what led to the change in the guidelines that we're publishing now.
The Society's guideline says women with an average risk of breast cancer, meaning most women, should begin yearly mammograms by age 45. Women should have the opportunity to begin
Thank you so much, Avis. So moving forward, I have addressed for you the burden in Louisiana. I have addressed for you the risk and the concerns that we have as a state. Now, let's get to us taking action. What can we do with self-management? What can we do as a community, healthcare professionals, and public health professionals? So, make healthy lifestyle choices. Women should get a clinical breast exam at least every 3 years, starting in their 20s, and get an annual exam and mammogram starting at 40. The breast self-exam is an option beginning at age 20. A clinical breast exam, it is the physical exam of your breast done by a healthcare provider, and it's often done during a yearly medical checkup. Also, understanding absolute risk and relative risk can help you make informed choices about your health. No matter your risk of breast cancer, a healthy lifestyle is important. Some healthy lifestyle choices are linked to a lower risk of breast cancer, which includes maintaining a healthy weight. Make exercise a part of your routine. Limit alcohol intake. Limit menopausal hormone use. Breastfeed if you can. And also do not utilize tobacco products. Most of all, get screened. Early detection is key, and early screening and testing are associated with improved survival rates. Next slide, please. For treatment options, currently breast cancer treatment is changing rapidly and advancing quickly. Treatments are tailored per patient, cancer type, and outcome needs. Both the CDC, Centers for Disease Control and Prevention, and Susan G. Komen offer excellent treatment education resources for men and for women. Next slide, please. So how can we help? What can we do? Provide support to combat cancer. Empower, target, engage for education awareness and support, and even promote screening recommendations and preventative care to all. You can get involved as an advocate. Being an advocate for breast cancer awareness and research funding is one of the best ways you can make a difference. Only through government action can we make the broad, systemic, and lasting change we need to help us achieve our goal of reducing the current number of breast cancer deaths in our state and in the US. By mobilizing our communities to take action, we can ensure the voice and needs of those with breast cancer and their loved ones are heard by policymakers and government regulators. What else can you do? Volunteer. When you volunteer with health organizations and awareness events, you're helping to save the lives of people in our community. Next slide, please. Here are a list of Louisiana resources. Please see these noted resources and organizations that help us together as one state fight breast cancer and service our residents. Next slide. Feel free to reach out to me for any additional information or resources or contacts. I can drop my contact, which is alicia.jones@la.gov, into the chat. Thank you guys for listening.
Thank you, Miss Alicia Jones, for that informative presentation. Next, we will go into our next segment, which is the breast cancer awareness segment. I'm a survivor. And at this time, we will hear the story journey of Miss Sylvia McLean during our I'm Survivor segment. Miss Sylvia?
Hi, good afternoon, you guys. Hear me?
Yes,
Hello?
ma'am. We can hear you, Miss
Oh,
Sylvia.
okay. Sorry for the background noises, but I'm at my oncologist right now as we speak, and I have an appointment for 3 o'clock. But my journey as a breast cancer survivor has been type of a dark type of journey because when I was diagnosed with breast cancer, it was COVID. So that means that nobody could accompany me to my appointments, and also a lot of it I had to do myself. And as far as that, I didn't have too many visitors. Nobody could come sit with me or anything because everybody was afraid of COVID, and my doctor didn't want anybody around me because of COVID. I was diagnosed on February the 4th. And after my diagnosis on February the 6th, I took a flight to Vegas. And while in Vegas, I received calls from like the social worker from the doctor. They were asking me if I was in denial. And what I was telling them that no, I'm not in denial. I choose to live. And when you choose to live, you don't let an obstacle stop you. You know, cancer to me is not for the weak. It's not for the weak at heart at all. And I feel like if you're weak, you'll never survive. You have to be strong. You have to put everything else aside. And during my diagnosis, how they found it was like 5 centimeters. It was small, small, small. So they saw it, then they didn't see it. Then they saw it and they kept looking for it. But what happened was I don't know how or why, and they couldn't explain it to me. Well, the knot, it kept moving. It kept moving. So when they couldn't find it again, they sent me to the breast cancer center in at the main campus of Osna on Jefferson Highway in New Orleans to a specialist so that they could do ultrasounds. And it just so happened that the time that I went, they had a doctor from like another country that was visiting and was shadowing them and all, and they couldn't find it that day either. But then I don't know what he did, but it was some type of micro ultrasound, and he was able to find it. And so that was the week after I got back from Vegas, and so they scheduled me right away because they said that the emergency rooms, the non-emergency surgeries were being shut down and they weren't going to take anybody else. And so that Tuesday, it was like that Tuesday, it was on a Tuesday, I'll never forget. I got to the hospital like 5:30 in the morning, and they told my sister that she wasn't going to be able to, come in or anything, that they actually had to stay out in the parking lot. And that's how bad it was. So when I got up to the counter to register to go in, they told me they weren't doing any surgery, that all services were closed down because of COVID. And I said, well, no, I'm scheduled. I'm here for 5:30. My doctor told me to come for 5:30. I said, oh, no, we're not doing any surgeries. Maybe about 15 minutes later, my doctor came in behind me because I was just dejected and I was leaving. And so he said, oh, we're doing the surgery today. So they explained to him that they didn't have anything in place. They didn't have, an anesthesiologist. They didn't have anything in place. He said, well, get it in place. Well, she said, it may take an hour or 2 hours. He said, I don't care if it take all day, get it in place. She's having surgery today. So I was very, very grateful for that. Very grateful for that. And, after the surgery, I think a lot of people say that chemo was the worst part of it, but chemo for me, it wasn't bad. It wasn't bad. But I think the worst part of my journey was radiation, because I did radiation every day for 4 weeks, every single day for 4 weeks, except the weekend. And I think that was the worst part of my journey. But I am a survivor, and I've been cancer free for the last 4 years, and I'm grateful for that. And that's my story.
Thank you very much, Miss Sylvia, for that. And I really do appreciate you sharing that with everyone today on today's webinar.
Hmm. You're welcome.
Okay, we're gonna go into our Q&A segment of the webinar. So if you have any questions for Alicia or Miss Sylvia, please feel free to drop them in the chat. For medical related inquiries, please contact your healthcare provider. So at this time, I will monitor the chat. Let's see.
Hi, this is Avis. While you're monitoring the chat, I would like to ask a question of Ms. McLean. Was there something different about your body? How did you know that you
Well, I did not know. I, as a my sister was diagnosed with breast cancer and had a mastectomy when she was 34 years old. So because of that, I had to be tested every year, because it ran in the family. Even though the BRCA came back negative, they still test me every year, not every 2 years and not every 3 years. They test me every year, as far as my other sisters too. In fact, ago, my sister that's just above me had a double mastectomy. So it is running somewhere in our blood.
absolutely. And in hearing your journey, it was very clear that you were a strong advocate for yourself. How important is that
I,
support system?
it's very important, because cancer is not for the weak. And when you're weak, you're beat. You definitely can't let it get into your head, because if you let it get into your head and stop doing everything, you're going to stop. Everything's going to stop. And I feel like it's not for the weak. You have to stay focused, and you can't let an obstacle stop you from doing anything. And I felt like it was an obstacle, and an obstacle, you either jump over it or you go around it. And I chose to do both. I chose to live.
If there's something that you could think about in terms of your treatment that you would say to the doctors, to your medical care team, what made the difference for you in your journey as you interacted with the medical professionals?
What made the difference in my journey is I had a very, very caring oncologist. His name was Dr. Daniel Ecuador, but he's no longer with us now. Him and his family moved to Houston. He was very, very attentive and very, very proactive. He was really proactive with me. He said, because I was proactive, I asked the right questions. I did what I was told to do, he was very, very attentive, and that made the difference.
Absolutely. And in your treatment journey, it sounds like radiation, as you described, was the worst part for you.
For me, but a lot of people feel like the chemotherapy was worse because it takes everything out of you. What you have to understand is that when they do chemo, it kills every cell in your body. It not only kills the bad cells, it kills the good cells too. And so that's why you lose your hair, you may lose your teeth because it's pulling everything, it's killing every cell, and they're gonna regenerate. And so that's where the weakness come in at.
So what changed for you during your journey? Talk to us about your nutrition before and after.
Okay, what changed for me for my journey, I used to eat a lot of sugar. I used to eat a lot of sugar, and now I don't do much sugar at all. It has to be few and far in between. Like I may have eaten a donut the other day and I couldn't finish it because I don't do sugar, so it was extremely, extremely sweet. And so I couldn't finish it because I'm not used to sugar anymore.
Absolutely. And fruits and
I,
veggies, what was your intake like?
my intake, I always liked a lot of vegetables and other fruit, so I didn't have a problem with that. But I definitely eat more now.
Absolutely. There is a, go ahead, Nia.
Okay. Thank you, Miss Sylvia, for that. Miss Alicia, our next question would be for you. Now, I know you said this, might have mentioned this in your presentation, but what are some factors that you think are most predictive of successful compliance with breast cancer treatment? You're muted.
With breast cancer, we definitely encourage healthy choices, changing and making healthier lifestyle decisions, which includes maintaining a healthy weight, exercising, eating healthy, lessening the consumption of alcohol and tobacco, obviously. For women having had no children or a first child after 30 also increases risk. We have also found in current studies that certain forms of oral contraceptives have been found to also increase risk.
Oh, thank you, Miss Alicia. Miss Sylvia, are you there? We have a question for you in the chat.
Yes, I'm here.
Okay. So what advice would you give to the newly diagnosed who may be in denial or lacking acceptance of their diagnosis?
My advice is to keep mind over matter. You have to have a strong mind. You can't think about what's happening and what's gonna happen. You have to live day to day, not think about what's gonna happen or what could happen. Live for today and you take one day at a time.
Mhm.
I'm of the belief that if I took one step, he'll take two.
Mhm. Thank you, Miss Sylvia. Thank you very much.
Mhm.
Okay, let's see. Our next question for Miss Alicia. Also, Miss Sylvia, if you would like to chime in on this question, that's fine as well. But I know that you covered some of this in your presentation, Miss Alicia, but what are some of the best ways to help manage breast cancer in a work setting?
I would say this educational training and webinar as such is a great opportunity to help create awareness and education to staff, employees, colleagues, because again, they are also caregivers. Some even are going through as a survivor of their own. So these opportunities and trainings as such are very much so a positive influence. Also, support groups. It's very much needed, from not only the physical support if, you know, that individual is going through the condition or experiencing it with a family member or close friend, but even more so the mental and emotional support. I feel that serves as a great asset with assisting and managing in the workplace.
I'm sorry, I was muted. Thank you, Miss Alicia. Miss Alicia, Miss Sylvia, are you there? I have a question for you.
Okay, I'm here.
Okay, so do you have any recommendations to reduce breast cancer risk? Because this could be kind of actually played between you
I
and Miss.
don't.
Okay,
I don't think there's any way that you could actually reduce it.
okay,
I really don't. I mean, I guess it would be a question for somebody in a medical field, but as far as
right,
me, I don't know. I don't know
right. Okay.
because I can't think of anything that I could have done differently to prevent it. Sorry about the background.
Oh, it's okay.
Of course, Miss Sylvia, you are absolutely correct. The exact causes of breast cancer aren't fully known, and no one knows why one person gets breast cancer and another one doesn't. You know,
Mhm.
breast cancer is complex and it's likely caused by a combination of risk factors, you know, but just from us learning about these factors can help us better understand our risk and efforts that we can take, you know, to reduce our risk of it. But yes, you absolutely are correct. There is not one, you know, set, you know, definitive matter that factor that we can attribute to it based on current research and studies.
And I totally agree with you.
Mhm.
It's also important that you see your medical professional and have your annual physical exam, have your annual wellness visit. That is so important. And there are also resources in terms of local community resources, but also doing that self breast exam. And as we heard in the presentation, also examining under the armpit. So I think that's one thing that people don't really hear in terms of doing that self breast exam, but that is so important as well. From a well ahead perspective, for the Louisiana Department of Health, what's going on in the health department in terms of making sure that the community is aware? What are some resources that are available in the community?
Yes. Well, definitely, I can assist you with that. So we definitely have our wonderful partner, Louisiana Breast and Cervical Program, which is an organization that assists and provide resources and preventative screenings for uninsured and underinsured residents. We also have our local parish health units. They are open for services and they do provide preventative screenings and patient navigation support, which is very important when it comes to the journey of serving as a cancer survivor and patient. We also have community health workers, you know, so not only consult with your physicians, consult with your care team, but also look to your community health workers in your community. They have a slew of knowledge and educational resources, not only when it comes to understanding the necessity of physical care, but also social factors and drivers that contribute to the onset of cancer and other chronic disease and cancer disparities. Thank you, Mercedes.
I can add to that. During my journey, I was assisted by the American Breast Cancer Society. I was referred by my oncologist, and there's also a site. I guess it's a national site called Beyond Breast Cancer, and they also had resources. But as far as local, the American Cancer Society provided insured. They had provided wigs, they provided head wraps, and it's all free of charge. All you have, I think, the only thing that you need to do is have a referral from your oncologist, because I wasn't aware of any of that. He provided me with those resources.
Yes, and I would like to piggyback, Ms. Sylvia, you're absolutely correct. It's Cancer Services Incorporated. It's near Independence Boulevard in Baton Rouge, Louisiana. Please share this resource. They are a partner of ours at Well Ahead, and they assist with incontinence supplies, nutrition support, cooking demonstrations, mastectomy supplies. So yes, definitely, they are a wonderful resource for our local residents that are currently undergoing breast cancer and other cancers as well as support groups for the families and caretakers.
What's the name of this organization?
Cancer Services Incorporated,
Okay.
INC. Yes, ma'am. It's on Independence, near the local, DMV. Mhm.
Okay, thank you so much, Miss Alicia and Miss Sylvia. Do we have any more questions? I would like to thank our speakers today. Did you all have any comments that you would like to add?
For me, thank you guys for the opportunity, and the best guidance and advice I can give you guys is go get screened. Early detection is key. Be aware, know and understand and be familiar with your body. And this goes for men and women. Seek preventative care. Thank you guys for listening.
Thank you, Miss Alicia. Okay, I'm going to send it right back to our Bureau Director, Ms. Avis Reshaw, for closing remarks.
Absolutely. And as you heard, as we promised, very informative information on the side of prevention and things that you can do. And then also how the health department is also working to improve our outcomes with regard to cancer outcomes. But what's essential to that is also improving our obesity outcomes, our nutrition, our water intake. So you're going to hear a lot more from the health department in terms of strategies that we're working on, especially around obesity prevention, as we're rounding out this year and also going into our next year. We want you to absolutely join us again in November when we will bring another important Well Ahead segment to you. We will have our very own Julie Knight, who will be presenting to us again. Also in December, we're going to be joined by Louisiana's own Rudy Macklin, who's going to describe for us, along with a couple other panel members, the importance of physical fitness, physical activity, increasing the level of activeness that you're doing to help improve your own outcomes, your own chronic disease outcomes. So please join us for the next two segments. It was a pleasure for you guys to join us today, and we look forward to having you again in November and in December. Thank you, Nia.
Thank you all for joining us today and have a wonderful day.